Did you know that heart disease is one of the leading causes of death worldwide? In the US alone, over 800,000 people suffer from heart attacks each year. What's even more alarming is that some medications that we take daily to manage our health could be contributing to this risk. You might not even know it. From painkillers to antidepressants, research has shown that several widely used drugs are linked to an increased risk of heart attacks and other cardiovascular issues. You may take these medications thinking they're helping your condition, but they could be silently damaging your heart in the background. In today's video, we're going to discuss 8 medications that have been scientifically linked to heart attacks, and I'll give you advice on how to stay safe. We'll also look at some alternative treatments you can consider and some lifestyle changes that can make a big difference. So, let's dive into the details and learn about these medications and how we can better protect our hearts. NSAIDs like ibuprofen, Advil, Motrin, and naproxen, Aleve, are some of the most commonly used medications. They're often taken for pain relief, reducing inflammation, or managing fever. They can work wonders for short-term pain relief, such as after an injury or for chronic conditions like arthritis. But what many people don't realize is that regular or long-term use of NSAIDs can increase the risk of a heart attack. According to a study published in the British Medical Journal in 2017, even taking NSAIDs for as little as 1 week can increase your heart attack risk by 20 to 50%, depending on the dosage. These drugs interfere with prostaglandins, substances that help regulate blood vessel function, inflammation, and blood flow. By affecting this balance, NSAIDs can cause increased fluid retention, raised blood pressure, and narrowing of the arteries. Over time, this can strain the heart and even cause blood clots, which are direct triggers for heart attacks. Now, I'm not saying you should avoid NSAIDs completely. In fact, they can be life-saving for certain conditions. However, frequent or prolonged use should be avoided, especially if you already have underlying heart issues. If you need to manage chronic pain, consider alternatives like acetaminophen, Tylenol for pain relief, or look into physical therapy, acupuncture, or natural anti-inflammatory foods such as turmeric and ginger. Selective serotonin reuptake inhibitors, SSRIs, and serotonin-norepinephrine reuptake inhibitors, SNRIs, are popular antidepressants used to treat depression, anxiety, and other mood disorders. Drugs like fluoxetine, Prozac, sertraline, Zoloft, and venlafaxine, Effexor, are widely prescribed to millions of people globally. While these medications are life-saving for many, research has shown that they can increase the risk of heart issues in some patients. A study published in JAMA Psychiatry in 2018 found that SSRIs, in particular, are linked to an increased risk of abnormal heart rhythms, higher blood pressure, and clotting issues. These medications can reduce platelet aggregation, meaning blood doesn't clot as effectively, increasing the chances of bleeding complications, including strokes. The risk of these side effects is especially higher in individuals with pre-existing heart conditions or older adults. The key here is to find a balance between the benefits of antidepressants and their potential risks, particularly in people who have cardiovascular issues. If you're struggling with depression and have concerns about heart health, talk to your doctor about alternative treatments. Cognitive behavioral therapy, CBT, and lifestyle changes, such as regular exercise, are excellent alternatives that can naturally boost serotonin levels and improve mood. If antidepressants are necessary, it's essential to use them under careful supervision and avoid abrupt discontinuation. Calcium channel blockers, CCBs, like amlodipine, Norvasc, and diltiazem, cardizem, are used to treat high blood pressure, chest pain, and some heart rhythm disorders. These medications work by relaxing the blood vessels and reducing the heart's workload. While CCBs are generally considered safe, certain types, especially short-acting ones, have been linked to an increased risk of heart attacks. A study published in Circulation showed that some calcium channel blockers are associated with a 25% increase in the risk of heart attacks. The reason? These drugs can lead to fluid retention, which can worsen heart failure and cause low blood pressure, leading to dizziness and fainting. Additionally, some CCBs can interfere with heart rhythms, increasing the risk of arrhythmias. For patients using CCBs, it's crucial to monitor for any side effects such as swelling, dizziness, or irregular heartbeat. If these occur, consult your doctor about alternative medications such as ACE inhibitors or beta blockers, which might be safer for people at higher risk of heart disease. Drugs like Rosiglitazone, Avandia, were once widely prescribed for type 2 diabetes to help regulate blood sugar levels. However, a major study published in the New England Journal of Medicine in 2007 revealed a troubling finding. Rosiglitazone increased the risk of heart attacks by 43% and the risk of cardiovascular death by 64%. Thiazolidinediones, like rosiglitazone, contribute to heart problems by causing fluid retention, which leads to higher blood pressure and puts extra strain on the heart. Over time, this can exacerbate heart failure or trigger heart attacks, especially in high-risk individuals. Fortunately, safer alternatives for managing diabetes exist. Medications like metformin, SGLT2 inhibitors, and GLP-1 receptor agonists have been shown to be safer for the heart. Lifestyle changes such as a healthy diet and regular physical activity can also help control blood sugar levels while reducing cardiovascular risks. Decongestants like pseudoephedrine, Sudafed, and phenylephrine are often found in over-the-counter medications used to treat the common cold and allergies. They work by constricting blood vessels in the nasal passages, which reduces swelling and helps you breathe easier. However, these decongestants can also raise blood pressure and heart rate, placing unnecessary stress on the cardiovascular system. Research, including a study published in the American Journal of Medicine, has shown that these drugs can increase blood pressure significantly, especially in people with hypertension or heart disease. If you have high blood pressure or any heart condition, avoid decongestants and opt for natural remedies like steam inhalation, saline nasal sprays, or antihistamines. Always check labels before using any over-the-counter medication and consult with your doctor. Chemotherapy drugs like doxorubicin are essential in treating cancer, but come with significant heart risks. Doxorubicin, in particular, has been shown to cause heart failure in up to 26% of patients, especially at high doses or with prolonged use. Doxorubicin damages heart cells by generating free radicals, which cause inflammation and scarring in heart tissue. Other chemotherapy drugs, like fluorouracil, have been linked to coronary artery spasms, which can restrict blood flow and lead to heart attacks. If you're undergoing chemotherapy, it's important for your doctor to monitor your heart closely. Protective medications like dexrazoxane can help minimize heart damage. Lifestyle factors like regular physical activity and a heart-healthy diet can also support heart health during treatment. Testosterone therapy is used to treat low testosterone levels, often due to aging or certain medical conditions. However, testosterone therapy has been linked to an increased risk of heart attacks, especially in the first few months of use. Anabolic steroids used for muscle building can also raise the risk of heart disease. Studies, including a significant one published in JAMA Internal Medicine in 2013, found that testosterone therapy could increase the risk of heart attacks by up to 30%. Steroids can elevate blood pressure, increase red blood cell production, and lower good cholesterol, HDL, all of which contribute to an increased risk of cardiovascular problems. If you need testosterone therapy, always use it under the supervision of a doctor. Consider non-medication treatments like strength training or lifestyle changes to boost testosterone levels naturally. Proton pump inhibitors, PPIs, like omeprazole, Prilosec, are commonly used to treat acid reflux and stomach ulcers. They work by reducing stomach acid production, but recent studies have shown that long-term use of PPIs could increase your risk of heart attacks. A Stanford University study found that PPIs can stiffen the arteries, contributing to higher blood pressure and heart disease. They also reduce nitric oxide production, which is essential for maintaining healthy blood vessels. If you rely on PPIs for heartburn or acid reflux, discuss long-term management strategies with your doctor. In many cases, lifestyle changes such as avoiding trigger foods, eating smaller meals, and elevating your head while sleeping can reduce symptoms without the need for medication. While these medications can be life-saving for some, they come with risks, especially to your heart. Always consult with your healthcare provider to assess whether these drugs are right for you. And remember that there may be safer alternatives or lifestyle changes that can reduce your risk. Stay informed, stay proactive, and always protect your heart health.